So just to put you into ease, see what happens is any patient comes to you, the most commonest will be the musculoskeletal or costochondritis pain. The second most commonest is a gastrointestinal pain. Third most commonest is a cardiac. Out of cardiac, 10% will be a stable angina. Hardly 1.5 will be the unstable angina. 8% are the psychiatric disorders, 5% are the pulmonary disorders, and 16% are the unknown causes of the chest pain. So this is the basic thing about the chest pain. So think about the musculoskeletal common causes first. Don't think about acute MI immediately patient comes to your clinic. Think about the commonest cause first, that is musculoskeletal or include the costochondritis. Think what kind of a pain patient is dealing with. I'll just explain you here what is a musculoskeletal or the costochondritis pain. The pain which is a localized pain, the patient can tell you the pain is in the right side or the left side. He can localize by your fingers or the hand. Second thing, this pain is not at all related with the exertion, that on exertion also patient will have a pain, on rest also patient will have a pain. It is a continuous pain. It increases with the movements of the hand and the chest and all other activities. It is not related to the rest. So this is a typical of a musculoskeletal pain, and that is the most commonest pain you face with. Second is gastrointestinal. The patient will present to you with the similar substernal pain. Sometimes the esophageal spasm will have a similar substernal pain which is relieved by the NTG, and the patient can mimic like a cardiac pain. But all these gastrointestinal pains are always associated with the watering of the mouth. He will tell you that I have a chest pain, I have a substernal pain, but it is also associated with watering of the mouth. It is not related with the rest. It is not related with the exertion. Then there is an association of a food with this kind of a chest pain. So what is a food association? If there is a duodenal ulcer or there is a gastric ulcer, after food, patient will get a chest pain. This is what is the association of a food with the chest pain. And then you must think that you are dealing with the gastrointestinal cause of a disease. Third most important is a cardiac. Then you should think if it is not musculoskeletal, it is not gastrointestinal, possibly I am dealing with the cardiac pain. So what is cardiac pain? We all know, I told you that these are the three important parameters. Out of three, if all are present, that is a typical angina. If the duration is less than 30 minutes, it is unstable angina. Duration is more than 30 minutes, continuous pain of 1 hour, 2 hours, then you are dealing with the acute myocardial infarction. This is what you should think. Then you should proceed for the further investigation. I'll tell you in the future this one. Then if it is not all of this, possibly you are dealing with the psychiatric pain, patient young age, usually young individual, the female patients come to you with the different kind of a chest pain. They tell you about the palpitation, they tell you about the depressive symptoms. Those are the patients who are actually having the psychiatric pain. Some of them have a dyspnea, some of them have a worsening with the respiratory movements. Those are the patients who are with the pulmonary chest pain. So the moment patient comes to your clinic, you are classified them, you have thought about the differential diagnosis, you all localize them into one of these categories, and that's how you should go ahead and you will clear your chest pain.